Several years after I started taking antipsychotic medication for my schizophrenia diagnosis, I noticed two things. The first thing I noticed was that my symptoms like paranoia, delusions, and hallucinations became very minimal, and some of the symptoms went away completely. However, the second thing I noticed was involuntary body movements and facial tics. It was explained to me by my doctor that these involuntary movements were due to tardive dyskinesia, or TD, which can be a really serious and troublesome side effect of long-term antipsychotic use. It was really frustrating finding out that I was going to have to change medication or reduce the medication that was working really well for me, even though simply stopping the antipsychotic medication doesn't always get rid of the involuntary movements. Now there are two VMAT2 inhibitor medications that were approved by the FDA for TD. They work with dopamine in the brain to help limit abnormal movements. A correct TD diagnosis is critical to starting treatment. Patients can be mistakenly diagnosed with drug-induced Parkinson's, which is another side effect that can lead to rhythmic movement. The problem is that treatment for drug-induced Parkinson's can worsen symptoms of TD, and the treatment for TD can actually worsen the drug-induced Parkinson's. So getting that correct diagnosis is critical. There are still many undiagnosed patients who could have an improved quality of life if they were properly screened and treated for TD. The overall goal of treatment is to reduce involuntary movements to improve the person's day-to-day life. If you've been experiencing any involuntary movements while on antipsychotic medication, let your care team know immediately. With the VMAT2 inhibitor, patients can see results in a matter of days, and improvements can last for years. You should not have to choose between having an antipsychotic medication that works for you and suffering from daily involuntary movements caused by TD.